Hey, Matt Fry, Environmental Health and Safety, out here at our site in Ohio. Today we're going to talk about gloves. So really, the important thing to remember about gloves, especially during this pandemic, is that your hands are just a vessel for bacteria, for viruses, things like that. And really, unless you're concerned about aseptic technique or a sterile environment for your patient, which these are not sterile gloves, right? So really what you're doing is you're transferring the vessel from your hands to a temporary vessel, which is the glove, right? So you want to put on your glove. Now, when I say it's used as a temporary vessel, that is extremely useful for, if you're going in to see a patient and you go in and you see that patient for a few minutes or whatever, take your gloves off and you're done. It can also be extremely useful if you're working with some sort of material that's potentially contaminated, right? And you need to service it, you need to clean it, whatever the case is. These are your best friends for that. These are a great barrier for any other blood, bodily fluids, things like that. So the trouble you run into with gloves, especially right now during the pandemic, is some people are wearing them all day long, right? Which can be a problem because people are not washing their hands with gloves on. So you're really just accumulating virus and bacteria on these gloves and spreading it everywhere, which is not great to do, right? So there's a time and place to wear them. So think about that. The proper way to doff or take off your gloves, right? So you want to pinch at the wrist, your first one, pull it off, crumble it up in your hand. Then you want to take your thumb or index finger, slide it under the cuff, pull it off inside out. Now you can toss that in the proper container. All right, thank you.